Hi, my name is Tiffany and I'm going to be demonstrating insertion and removal of an NG tube as well as documentation of intake and outtake for fluids. So I have got the doctor's orders. It is for Shirley Cost, 5/14/1964. She has been admitted to med-surg for a small bowel obstruction. The doctor has ordered ultrasound of an abdomen at the bedside, insert NG tube for gastric decompression, an x-ray of the abdomen after the NG tube insertion, and attach the NG tube to a low intermittent suction. So before I go into my patient's room, I am going to perform hand hygiene. And as I'm entering the patient's room, I just passed the doctor and he said that he has explained everything to Shirley of the procedure. So coming in, good morning Shirley, how are you today? My name is Tiffany. I see the doctor just left and explained the procedure to you. If you have any questions, Shirley says no. So Shirley, how are you doing today? You have pain. Her pain, what is your pain on a scale of 0 to 10? Her pain is a 6 out of 10. So I am going to, Shirley, if you could please tell me your name and date of birth. Shirley Cost, 5/14/1964. Shirley Cost, 5/14/1964. Shirley Cost, 5/14/1964. Perfect. Okay, so since Shirley's having pain, we want to assess her bowels. I'm going to drop this down just a little bit, Shirley, and lift your gown. And Shirley is hypoactive in all 4 quadrants. Put that back up for you, Shirley. Okay, so I've also explained to Shirley that when we do the insertion of the tube, we have come to an understanding on hand signals. So if everything's good, she's going to give me a thumbs up, and if it hurts or she can't breathe, she's going to hold her hand up so that I know to stop, and I promised her I would stop. So I'm going to sit her up in the high Fowlers. And I am going to place a towel over her. This will protect her from any fluids that come out through her mouth or whatnot. I have her emesis basin. I have a cup of water, or ice water with a straw. And now I am going to measure the NG tube. And we are going to go from the tip of the nose to the ear, and from the ear down to the xiphoid process. And then I am going to mark my tube. And I am going to don my gloves. How you doing, Shirley? Okay? Okay, and before we place the tube, I need to check the patency of her nares to see which one is going to be better. So, Shirley, I'm going to block this side, and if you could please blow. And this side and blow. And Shirley says that the right one feels better, so we're going to put the tube in the right nare. So I am going to get my lube, and I'm going to get my adhesive for the nose, and I'm going to get an alcohol pad, and I am going to lube 3 to 4 inches of the tube. And I'm going to clean Shirley's nose real quick, so that by the time I'm ready to attach it, it'll be dry. Okay, Shirley, we're just gonna clean right here. Okay, so Shirley, I am going to insert, I'm gonna take the pillow out from behind her head and have her hyperextend her neck. Okay, Shirley, on the count of 3, I'm going to start inserting. 1, 2, 3. And I'm going to go just to the back of the throat when she gags. And I'm going to pull it out 1/8 of an inch. And then I'm going to have Shirley bend her head forward, closing the epiglottis. Okay, Shirley, now I need you to drink, and each time you swallow, I am going to push the tube in, okay? So on the count of 3, I need you to start swallowing. 1, 2, 3. Swallow, 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 swallow. Perfect. Okay, so now I'm going to attach it. Okay, we're going to attach the tube. Making sure that the tube is not resting on the top of the nair because we do not want to get skin breakdown or sores. And then I am going to get my syringe. I'm going to pull it back 10 milliliters for air, just in case when I unplug this that the gastric juices are ready to go. So I'm going to unplug, and I'm going to draw. I'm going to plug that back up, and I'm going to put this in the medicine cup. And then I'm going to put this in the biohazard bag. And next, I'm going to secure, actually take my gloves off, and I'm going to perform hand hygiene. And take away her Emerson basin and her cup and her towel. And I'm going to get some tape. We are going to wrap this around the tube so that we can secure it to her gown so that it doesn't go anywhere. Okay, Shirley, you doing okay? It feels okay? Yeah, I know it's not real comfortable. Okay, so at this point, I'm going to don gloves again, and I am going to check the acidity of her stomach as well as check the color and the consistency of the gastric juices. And I'm going to get my litmus paper. And the chart. And we are going to dip this in. And it's going to change color, telling me the acidity. And we are, it looks like we're at a 3, which is good. So this would go in biohazard, as well as this. Okay, so I am now going to hook her tube to the suction and low section, and I am going to clean everything up. I have called an x-ray to come down and take an x-ray to make sure that the tube is placed correctly. Taking off my gloves, aftercare of the room, hand hygiene, and Shirley, I will be back to see you shortly. So I've left the room, x-ray came, and now I'm coming back to take the tube out. So back in. Hi Shirley, how are you? Good. Again, let me confirm your name. Shirley Cost, 5/14/1964. Shirley Cost, 5/14/1964, and Shirley Cost, 5/14/1964. Okay, Shirley, are you ready to get that tube out? Perfect. Well, we're going to assess your bowels again real quick. So I'm going to lay you down. Okay. So she is active in all 4 quadrants. And Shirley has told me that her pain is down to a 2. Okay, Shirley. I've explained the procedure of how we're going to do this. I am going to unpin her. I am going to don my gloves again. I'm going to get an alcohol prep ready. And my gauze. And I am going to, before we pull that out, I'm going to draw back 10 milliliters of air, and we are going to make sure that there's no gastric juices in the tube. Clearing the tube. Okay, Shirley, I'm going to take off the nose with the sticker using the adhesive. We're going to wipe this off so not sticky. Okay, Shirley, now on the count of 3 I need you to hold your breath. Deep breath, hold it, ready? 1, 2, 3. Perfect. And I'm going to take this and I'm going to put it in a biohazard bag. I'm going to take off my gloves. I'm going to do hand hygiene. Okay, Shirley, and I would like to assess your bowels just one more time. And good, we are still active in all 4 quadrants. Okay, I'm going to give Shirley back her pillow. And Shirley has no more questions, so I am going to do my aftercare of the room, cleaning everything up. And I am going to wipe the inside of Shirley's nose. Make sure we get everything out of it. If Shirley needs any type of assistance with oral care, I would do that for her also, as well as offering her some more water to get the taste out of her mouth. But she said that she's good and she's got it, so we will let her go. And I am now going to document what I have done. I'm documenting how the patient tolerated, the length of the tube. We're going to document the quadrant sounds, and I'm going to now measure the intake and output. So I've unhooked from the suction, and I've got the numbers that I need. So I'm going to come over here, and I'm documenting. I have totaled everything up. And I am putting, whoops, before I leave the room, I'll put the thing back up to keep her safe in bed. Shirley's good, and you have a fabulous day. Thank you.